We are going to round out this show by checking in with Dr. David Donaldson. He is the chief over at Beaumont Troy ER Center. Doc, thanks for being with us on the MegaCast.
Yeah, thanks for having me. Good morning.
Dr. David Donaldson with us. How are you? How's your team over at the Beaumont Troy ER Center doing?
Yeah, we're hanging in there. Luckily the COVID numbers are down. The patients we're seeing seem to be less sick than initially. So, yeah, we're getting back to some normal business. Luckily.
COVID-19 continues on. Flu season also coming up. How are you and your team at the ER Center preparing for that dichotomy of issues?
Sure. So we're ramping up testing best we can, anticipating, when these patients present with COVID or influenza, it's going to be very difficult to tell who's who from, just the initial presentation. So we have to be basically assuming everybody has COVID until we make sure they don't with those scenarios. So we're ramping up testing. We've discussed, worst case scenarios. If it gets really bad, alternative sites to see some of the more mild patients to keep them out of the ER and leave that area for the patients that are more sick, if you will. So yeah, we're kind of looking at all scenarios with testing and alternative sites if it gets to that point. But I'm encouraged just reading some data from the Southern Hemisphere with regards to influenza, and they're seeing actually very low volumes, historic low volumes of influenza. So I'm hoping the social distancing and masking will keep those numbers down as well.
Yeah, we are all learning to wash our hands a lot more often during this, so hopefully it does help prevent the spread of the flu as well. I'm curious to know, in the beginning of this, a lot of people that maybe needed to go to the ER, they weren't making that trip because they were afraid of getting COVID-19. Are you still seeing that, or are things pretty much back to normal?
Luckily, we're not seeing the severe illnesses not come in like in the beginning, the heart attacks, the strokes. Those sort of patients were not coming in, and unfortunately, some of those patients didn't make it. We're not seeing that so much. Those numbers have returned to normal. What we are seeing is a real decrease in the number of pediatric patients and more of the minor care stuff, and I think some of that is more reflective of the high school sports haven't been back until recently. Schools aren't most schools are not live. So the numbers of other things like stomach flu and other respiratory illnesses, we're just not seeing. But the major stuff, we're back almost to normal. To give you some perspective, we're running about 80 to 85% of our normal volumes in the emergency center as compared to pre-COVID.
I'm always confused, like, okay, so you're a parent, your kid falls. When do they make the decision on when to take them to the hospital versus like an urgent care, or just try to monitor it at home?
I mean, that's a personal, decision that I think, obviously, if it's a true emergency, come in, don't ask any questions. But if you're debating it, physicians, private physicians are always on call, so you can run it by them first and potentially get seen in their office. But I want to reinforce that if you have an emergency, we have a separate process if we suspect that you have COVID. And, so if you come in with a non-COVID-like complaint, you won't be anywhere near, patients that we're suspecting COVID. So if you're debating it at all, we're definitely have a safe way to do it. But yeah, to answer your question, if you're debating, should I go, shouldn't I go, your doctor would be somebody to reach out to.
I know in the beginning, the hospitals were limiting people going in with their loved one. Has that changed now, or what are those protocols like?
Sure. So we do allow visitors for everybody. We do limit it depending on the scenario, and we try to keep it to one visitor per patient. Obviously, if there's extenuating circumstances, those rules can flex depending on the situation. But we try to limit it best we can to one visit per adult patient and two for a pediatric patient.
On that note, is there anything that goes into that involves symptom checks and testing and so on for those visitors? Is there a list of people that maybe are listed for the patients in the hospital as potential visitors that then you're reaching out to. How does that process work in terms of bringing those people in to visit their loved ones, but also ensuring that they are safe and others are safe as they come in?
Sure. So, I mean, everybody's obviously required to wear a mask. A questionnaire, we have greeters at all the entrances. So questionnaires and checks as a screening process is done at all the entrances. Nothing's 100%, but it's a pretty good system to, if you're not feeling well as a visitor, and then not to come in. Then the other thing to consider is if you're a visitor with medical issues yourself, you might want to, obviously think about your own situation before entering the hospital as well.
Dr. David Donaldson with us. He's the chief at Beaumont Troy ER Center. And Doc, while we have you on here, talking about when a person is asymptomatic, what's so hard about this, you don't know. You don't have any symptoms. So as you're making these procedures and plans, what conversation is around trying to address asymptomatic?
I mean, again, it's a very, very good point. And that's one of the big problems with this virus is you can have very minimal symptoms or no symptoms at all and still be contagious. So we have to really just rely on symptoms. I mean, if you have no symptoms, there's really not much to go off of other than if you had close contact with people with known COVID. And that's part of the screening process as well, your recent contact information with potential patients.
So as we move into the flu season, is it going to be possible for someone to have the flu and COVID at the same time? And then what would be the policy to treat them?
Sure. No, it's interesting you asked that because in the beginning, when this all started in March, the thoughts were that you could not have both at one time. And the CDC guidelines at that time were actually to test for influenza first. If you didn't have it, then test for COVID. And that's when the testing was very limited. Luckily, we can test for both right now on the same machine. Yeah, I mean, you can, at this point, the thought is, yes, you can get both at the same time, but that has differed from the initial thought several months ago.
I know that so many medical professionals, such as yourself, you're looking to the CDC to help guide you through this pandemic, but every day in the news headlines, there seems to be politics or getting in the way of this. How reliable is the CDC? And for the general public, what do you want them to know?
I mean, I do think it does become frustrating as a provider as well with their guidelines, changing often. I do think they're reliable. I think you have to be fluid in this because nobody's ever been through, this particular COVID virus before, or, in our lifetime, another pandemic. So we have to rely on somebody and we have to all be on the same page. So I think it is a good mechanism for that. So we can be standardized best we can versus everybody kind of doing their own thing. I do think common sense, has to play a role as well. Mask and social distancing, I mean, the facts are it works. I'm not always a fan of it, and I'll be happy for the day that, we can go to a sports game or a concert again without a mask. But for right now, I think it's the best thing we could do for the safety of ourselves and the public.
Dr. David Donaldson with us. He is the chief of the Beaumont Troy ER Center, joining us today on the Oakland County Megacast. And on that topic of advice, as families are entering the flu season, with some of their kids in person learning for their schools and others not, and with people getting back into the regular swing of life to some extent over the last couple months and as we go forward, what advice do you and your team have for people and for families going forward in terms of keeping themselves and others safe as we're heading into a flu season on top of the continuing COVID-19 pandemic?
I mean, I think it is a balancing act, getting back to somewhat of a normal semblance of life. I mean, there's a lot of fallouts that, haven't made the news yet, if you will. And I mean, our mental health patients, the census for those type of patients has really gone up during this pandemic. I think just the normalcy of kids getting back to school and social interactions are important. I think we have to do it smart, but I think we also have to try to get back to some normalcy. Just personally speaking, I have a senior in high school, and they're back live to school, and they're doing well with their screening process. I've got two kids in college. Unfortunately, my son's a freshman at Michigan State and was supposed to be in the dorms and is now living at home. And, and he's not happy about that, because you're missing out on these great, potential great times of your life. So I think it's important to do it smart, but I think it's also important to get back to some normalcy.
Yeah, I always wonder, for people such as yourself, when you have that medical knowledge behind you, what is it like when you go out in public? What are your thoughts and what are you seeing?
Sure. I mean, I obviously see now in Michigan, everybody masking, or for the most part masking and social distancing. And again, I'll be happy when we're back and don't have to do that, but I think it's the right thing to do right now. I'm supportive of getting kids back to school safely, as safe as we can, but they're, for the most part, a pretty low risk group. The hospital numbers that we're seeing are dramatically down. I think we really have to follow the hospitalizations and the mortality, the deaths, more so than even the number of cases, because as testing increases and becomes more readily available, of course, the number of cases are going to go up. And certainly for trends, that's important. But the real important part is hospitalizations and deaths.
So since your son goes to Michigan State University and he's staying at home, I think you should get a rebate on your tuition, at least a little bit of a discount. A lot of parents are thinking that right now. In talking about testing, how accurate are the tests?
So it depends what test you're talking about. There's several different tests. The one that we use at Beaumont is called a PCR test, and it's a swab that goes deep into your nose. It's an intranasal swab. And those are very, very sensitive and reliable. Unfortunately, there's a federal deficiency, or the amount of the reagent, so that the fluid or the reagent that you need to run that test is being subsidized to the various hospital systems. So they're not unlimited, and that's the problem. Is very limited with that sensitive test. The other tests, like that you can get back and go to like an urgent care and get back in 15 minutes, those are called antigen tests. And they are not quite as reliable and sensitive, especially when you don't have symptoms. So when you hear these, and I'm in favor of it, like these sports teams and whatnot testing every day, it's good to get a sense for it, but it's in the absence of symptoms in particular, the yield goes down with those tests.
Dr. David Donaldson with us on the Oakland County MegaCast. He is the chief of the Beaumont Troy ER Center. So at this time then, Dr. Donaldson, with that in mind, do you believe that people should be getting regularly tested for COVID-19 still, or is it still something where you should get tested if you're feeling a little bit under the weather, or if you're going to be going in for any sort of a medical checkup or procedure or whatnot? When should people be getting tested, whether it is the more accurate test or one of the more rapid response and less accurate tests?
So I'll just speak for Beaumont, the elective surgery cases that we have here, there is a process that patients get tested 2 to 3 days prior to the procedure. So those patients all get tested, because if it's elective, it can obviously be postponed, if you're positive. Luckily, those patients that are getting the pre-screening testing, the numbers are really extremely low, like way less than 1% that are coming back positive. But again, those are patients without symptoms. I think if you're going to be not able to use social distancing and masks like football teams and sports teams, then it's probably more important to get tested, just so your teammates and other people are not put in harm's way. But if you have mild symptoms and you're going to self-quarantine, or you were exposed to somebody and you continue to have no symptoms, I mean, as long as you're going to quarantine yourself, it really doesn't matter what that test shows. To be honest, it's if you're gonna be around people and not able to distance, then it's probably more important than if you can just stay home and ride out the symptoms.
I know you're an ER doc, but going into fall time, fall allergies, so many people are getting freaked out because they don't know if they have allergies or if they could possibly have COVID. And now we're going to be throwing the flu into this mix. What do you suggest for just the general public to try to navigate this new world?
Sure. No, I hear what you're saying. Every time I sneeze, I think, oh my goodness, there it is. But you just have to use discretion. I mean, if you're sick enough to need medical attention, 100% come to the ER. If your symptoms are very mild and you can quarantine yourself, I think you have to treat during a pandemic everything as COVID initially, because you just don't know. And I'm not saying every time you sneeze or have a sniffle, but if you have symptoms that are not the norm for your allergies, and back in the day last year, if we had a cold and a low-grade fever, we'd tough it out and come to work, and that's just not going to be able to happen this year. So we have actually put in contingency plans to cover each other when we get into those scenarios here at the hospital.
So anything else you want to touch on before we let you go? Are you seeing an uptick in any type of case over something else?
No, the numbers are good. They're manageable. So I think what we're doing is working. I mean, it's definitely, we're not overwhelmed at all in the hospital or the ICUs right now, at least locally. So I would just say keep doing what we're doing and try to integrate back into some normalcy best we can. And hopefully we have a vaccine sooner than later.
Yeah, because now that things seem to be back to normal at the hospitals, do you have a better plan if we have a second outbreak?
Oh, for sure. I mean, we learned a ton. Again, this was all of our first time through anything like this. So the learning curve was pretty steep, back in March and April and into May. But lots of lessons learned in terms of not only the management of COVID, but, how to isolate those patients, how to protect ourselves, and like I said initially during the interview, is that we now have contingency plans if we do get overwhelmed on different spaces in the hospital that we can use if it ever got to that point.
Well, let's hope it doesn't get to that point. We get a vaccine soon and we can all get back to living life as normal and going to the Lions game and booing them in person.
I agree. I want to go back to a Spartan game.
Go green. Well, Dr. David Donaldson with us. Thank you so much for being with us on the MegaCast. We definitely appreciate your time.
Sure, anytime. Thank you.